What effect does winter have on heart disease?
So basically in winters what happens is that the blood becomes thicker, the blood pressure goes up and the heart rate goes up, and that puts a increased strain on the heart.
Sir, I also read recently that in winters the ideal time for exercise or walk is afternoon.
That it is not necessary for anyone to just keep a fixed timing for walk in the morning or evening. It is more of convenience and good weather in the summer especially, that you go in the morning time because you can't walk in the sun time. But in winters you can walk during the afternoon time. So it is absolutely reasonable if somebody has the time.
Good morning everyone. Myself Dr. Rahul Arora. I am working as a senior medical officer with State Bank of India. Today we have with us Dr. Praveen Chandra. He is a senior interventional cardiologist at Medanta Hospital. The topic for today's discussion is winter and heart disease. So we'll start straight with Sir. So as per you, what effect does winter have on heart disease? Like we know in Delhi the season of winters is very harsh. So what effect winters have on heart disease? Can you please elaborate and explain?
Yes. So Dr. Rahul, I think it is a very, very important issue that we try to prevent heart problems and which actually increase in the winter times. So how do we do that? Why it happens? I'm going to explain to you today. So basically in winters what happens is that the blood becomes thicker, the blood pressure goes up and the heart rate goes up, and that puts a increased strain on the heart. So those people who are having heart problems and those people who are at the verge of having heart problems, which means there is a hidden heart disease, can become manifest, and these people suddenly develop a heart attack or a heart problem and then come to the hospital. That is one part. The second part is that also that there is more pollution, there is increased cold air which leads to lung problems, increased chances of developing infection in the lungs, and that again puts a pressure on the heart. So this is why these patients, many patients in winter times come to the hospital and get admitted or get treated for respiratory distress, which means that they are having problem in breathing, and this breathing problem can be because of the lungs or because of the heart.
So means we have a double pressure on the heart from respiratory disease also and from the cardiac disease, cardiac point of view also.
Yes.
So that was, sir, very nicely explained by you. So sir, what do you think over the time, over last 25 years, how the things have changed? If we consider about the heart disease and related to weather and higher AQIs, how you think in last 25 years it has changed?
Okay. So that is a very important question, whether anything has changed. I think nothing much has changed except that the capacity to treat these patients have improved. We have more ICUs, we are more trained doctors, we are more kind of experienced to deal with this problem, and more effective medications.
Okay.
So that is why it is very important, if somebody develops this kind of a problem, he should immediately get in touch with the a cardiologist or a physician who is the nearest, and also have access to the nearest hospital so that treatment can be done as early as possible. That is very important. If somebody has these symptoms, they go to the nearest facility, and there are so many facilities now. In the last 25 years, really we have so much upscaling of the capacity of treating such kind of patients. That is something which is very good. We have, as I told you already, we have very effective medications to treat with this problem. The second thing is that when this winter happens, there are multiple things happening. One is that we are eating more, traditionally, socially, culturally. We eat more, food, and because we want to keep ourselves warm, so that is why everybody is saying that eat more, okay? And eat more salty food, eat more sugary food. So what happens is that when you eat sugary food, eat high salt food, two things happen. One, those people who have diabetes, the diabetes will get uncontrolled. number one, and number two, the blood pressure will go up. So when the blood pressure goes up and the sugar goes up, it leads to like a, kind of a tsunami of problems in the body. The body is trying to fight it out. And then the blood pressure goes up, the heart rate or the pulse rate goes up, and everything is disturbed. And then is the time, this is the perfect environment for the heart attack to come in. Is the perfect environment for the lung infection to come in. Then the third thing is people are not active. They are not walking too much. Everybody is saying that I do not want to walk, it is so cold outside. Okay? And that is why again the blood pressure is going up. Their activity is not happening. Then the next thing is about the eating is that they drink less water.
Yeah.
In winters, we drink less water. So we have to be conscious that we drink more water. Because if you drink less water, basically our blood will become more thicker. If the blood is thicker, there is a higher chance of clot formation inside the heart, especially in those patients or those people who are having diabetes, who are having high cholesterol levels, who are having previous heart disease. These are the people who come to the hospital very soon again, right? So this is the big problem. Now, another problem which is these are all the bad cousins of winter, I must say. So another bad cousin of winter is those people who are smoking. They'll start smoking more because they feel that with smoking they will get some warmth inside. And again leading to more chances of heart attack, more chances of lung problems. So all these bad cousins come together to create these problems, and this is what we have identified now. So the risk factors, the people who have more risk will have more chances. People who have already a heart problem, like for example, somebody had a heart angioplasty 2 years back, 3 years back, or a bypass surgery few years back, or is being treated for heart problems. These are the people who should be very conscious of drinking more water, continue your activity. If it is too cold, you can go in a little, when the sun comes in, or when it is little warmer, you can go out, wear layers of clothes, and then you can go outside. There is no problem. So that is why we keep recommending everyone that do not stop all this. If you do this, then the winter is a good weather, but it actually kills people, So that is why prevention of heart attack, prevention of lung problems is the key to success and preventing people from going to the hospital rather than treating more. So our hospitals become fuller. Our ICUs become fuller when the winter sets in. So that is where we are right now.
Sir, I also read recently that in winters the ideal time for exercise or walk is afternoon rather than morning and evening, because we have more pollution. In afternoon the pollution is also settled, temperature is also good. So that is a good time the patient or the person can have this exercise or walk. But you know that people are working right now and it is very difficult for them to have an afternoon walk or something. So I also sometimes advise my patients that if you can't go in the morning or evening, get a walk after lunch or before lunch.
Absolutely correct. That it is not necessary for anyone to just keep a fixed timing for walk in the morning or evening. It is more of convenience and good weather in the summer especially, that you go in the morning time because you can't walk in the sun time. But in winters you can walk during the afternoon time. So it is absolutely reasonable if somebody has the time. Because if somebody is working like 9 to 5, he cannot go for a walk. But actually he can do that during the lunch time. If there is a break, they can go for a walk. Then eat less. Also, this is a very important thing, that do not try to overeat. I don't say eat less. Do not try to overeat, because people try to overeat to get more energy and more things like that. And then the third most important thing is that the blood pressure should be checked. We have seen, and it is a known thing, that people develop high blood pressure during winter times. They are taking the same medicines and the BP is going up. Why? Two things. One, there is less sweating, so the salt is not going out of the body. The second is that the blood is becoming thicker and the vessels are getting constricted because of the cold weather. So that's why the BP goes up. So if somebody is like walking, exercising, drinking lots of water, chances are that the BP will not go up. But if the BP is going up, you can take additional medications to bring the blood pressure down, because blood pressure is also a silent killer. Okay, so we generally feel that BP is not a problem, BP is it goes up and down, etc. But actually the heart problems and many other problems like kidney problem, etc., or brain stroke for that matter, happens because of fluctuations, serious fluctuations in blood pressure. So blood pressure must be checked, and these days if somebody has a machine at home, it's quite easy to measure it, and anybody can measure through those automatic machines.
So do you consider these machines, like you have touched upon the topic, these machines are accurate, accuracy wise, like?
So generally these machines are now reasonably accurate. Earlier it used to be that they were not so standardized, but now many companies have very standardized machines which can give us an idea of where the blood pressure is going. Because if you are measuring all the time, like you are measuring in the summertime, you are measuring in the winter time, you are measuring once in a week, once in a month, you will know how the blood pressure is moving. And that is also an indicator. If the blood pressure now is going up, in the summer it was okay, that means the machine is the same, the blood pressure has gone up. So those are the usual logical conclusions which one can take. Yeah.
So it was very nice discussion, sir. One or two more questions we can take.
Yes.
Like I was wondering, like in all the patients we have to increase the medications for blood pressure, or like if you consider a cardiac patient. So before, like in October, November, what all medication we have to increase or we have to alter, if you can throw some light on that?
So this is a very good question. Yeah. So we do not have to take any special medications for winter for that matter. But we have to be careful. And if the blood pressure is going up, we can increase the dose of that particular medication, or we can add another medication, but that again should be done with the help of the local doctor or the physician.
The physician or the
physician will do that. The second is that if one takes care of the eating and the exercise, many times there is no need to even increase the medications, because many times the patient is just sedentary, he is not going out of the home, he is not, he is drinking a lots of, eating and drinking lots of things with more salt, that increases the blood pressure. So you control the food, you control your walking, you do everything, sleep well, I think the blood pressure will many times just go down without taking medication. So usual change in habits can also do the trick. Yeah.
So one thing more I would like to ask or add, something about yoga we can, like for the cardiac patients,
I think
for hypertensive patients, and home yoga, something like that.
I think that's a very good idea, because yoga can be done in home.
Obviously.
And you don't have to go out. So adding yoga to your usual activities will be a very good addition to the exercise regimen or the activity regimen, and it will definitely help in reducing the blood pressure. So I think people can do yoga at home with the help of do-it-yourself videos, etc., or learn from someone. And there are books also on yoga, so you can do that. Yoga is not such a difficult thing; it can be learned quite easily.
At least the basic yoga and basic
can be done.
asanas we can do at home.
It will help. It will help.
So,
certainly.
Sir, that was a very nice thing from you. So we can just summarize in last 2 minutes if we can.
My message is that in winters, be careful, be active, eat responsibly, eat judiciously, and keep checking your blood pressure, blood sugar. And those people who are having already high blood pressure or who are heart patients should be a little bit more careful. Then you don't kind of go out in the open or expose yourself to extreme cold without layering yourself properly. Then it will definitely strike you. But otherwise, if you are careful, if you are doing your things, careful does not mean, for that matter, that you just stay inside only. Because many times people feel that just staying inside will be fine, I will be protected. No. So you have to do the whole thing, and of course be protected by covering yourself, by leading to less exposure. Because many times I have heard that old ladies have come to me that suddenly they became breathless, etc. What happened? They said they went to the some spiritual what do you call them, discourses when they happen in the open air. A lot of people are sitting for through 2, 3, 4 hours in cold air, they get exposed. So try to avoid that, And even if you are going, be covered, drink lots of water, and everything will be fine. Okay?
So it was very
Thank you.
nice talking to you and hearing from the most senior person in Medanta, Dr. Praveen Chandra himself. So thank you, sir.
Very much.
Thank you very much.
I hope that with these small tips,
Yeah.
people will benefit. And if there is anything else in the next session, we'll bring up more.
Sure, sir.
Thank you.
So for the patients, the takeaway message, be active, to drink plenty of water, follow your routine, have less salt, and no smoking. Thank you.